Okay, so I have Brandon arranged on his back right now, and he's just on a futon. I'm in a chair, and the futon's a little low for me to stand and do like a long treatment, but I'll stand up at points. That's why I have a little rolly chair, so I can sit and be comfortable, and then I can also stand if I need to. So first I'm just going to say hello to the shoulder joint. Hello to my little friend, the shoulder joint.
Hello.
Inappropriate. So I'm just holding Brennan's hand and wrist. I'm giving just little shakes. Stand up because you kind of want to be able to have maximal control. And I'm just shaking the arm, shaking the joint. And once I've warmed it up a bit, I can give like a gentle pull. So I'm pulling towards myself. This is a grade 1 or grade 2 traction. It's like pulling on the limb gradually, bit by bit. And you shouldn't feel like you're maxed out. Do not pull their arms super hard, especially if the person has a history of dislocation. So I'm just, again, squeezing his hand between my hands and just gently pulling out. Now opening up the joint like this is going to promote fluid circulation inside the synovial joint, inside the joint capsule. So I can just swing, shake, swing it, shake it, move it, make it. Points if you know who that artist is. Brandon, do you know?
I'll pass.
Okay. I can do a posterior glide, so meaning I'm moving the head of the humerus or the top of the shoulder bone down. So I'm going to slide one hand under, feel the shoulder blade, feel like the flat bony part. And then with my other hand, I'm going to place it on the round top of the arm. And I'm just going to apply oh, you okay?
Yeah.
A little bit of a clicking occurred there. So I'm just applying a gentle, like super, super slight pressure downward onto the arm bone. So basically I'm pushing the top of the humerus into the back of the joint capsule. And you can do the opposite. You can do an anterior glide. You can do it when the person's face down, or you can just simply stabilize the collarbone and just lift up, slip your fingers under and just lift up on the back side of their arm, like on the tricep. Okay, so I can do an inferior movement to glide the joint, and for this one, Brandon, I'm just going to pull your arm like that. So can I get you to keep your shoulder relaxed if possible, but keep a bend in your elbow?
Yep.
So that I can just pull your elbow down. Pull his arm down. And when I do that, you might also feel like a gentle stretch, or the person you're massaging might feel a gentle stretch in the upper traps too. Okay, so while we're still on our back, I'm just going to place some pressure on the different muscles that connect to the shoulder joint. Just some static holds. You've probably heard me use the phrase static hold before if you've seen any of my other videos. And I just mean pressing down on the tissue and not really doing anything specific or moving very quickly. So I'm getting into the pecs a little bit. I can get in with my fingertips just below the collarbone, into pecs as well, subclavius muscle, and that might feel really, really good for the person. And then as I approach the shoulder, I'm kind of hooking my hands in and just digging in and pulling towards me a bit. Whenever you're applying pressure on tendons, which are the part of the muscle that attaches to the bone, like how when the muscle turns into like a whiter, stringier section and attaches to the bone, it's pretty sensitive to massage over tendons. So just keep that in mind when you're choosing your pressure. And then in this position as well, you can do deltoids. You can apply some lotion or some oil, and you can do with a fist, you can do some kneading of the deltoid muscles. So the delts are like a round like cap on the shoulder. In the front, on the very side, and a little bit in the back, like a teardrop shape almost. And so I'm just kneading away. Can do some little circles. I like to let gravity help me for massage, so I'm jamming my fist underneath Brandon's arm and his shoulders just lying like heavy on the futon, so I'm just doing some little circles and it's just his body weight creating the pressure. And if I want to create more intensity or like more pressure, I can just push down with the other hand too, because then you're not having to push your fist up, you're not having to use like your forearms or biceps as much. Beautiful. Do you want to go on your side, dear? Nice and soft. And then I'll put this one between your knees. How's that?
Good.
Okay. So yeah, so pillow the person so they're nice and comfy. So I'm just getting really comfortable here. You good?
Yep.
Okay. I just want to make sure I'm in an ergonomic position too, right? You don't want to be hunched over with a rounded back. You're going to burn out really quickly. I want to get in at these muscles on the side of his ribs, so serratus anterior and lats. So I'm just going to take my two hands on top of one another and just press with like a medium pressure and just do some circles. So I'm not like rubbing his skin. The circles are, I'm planting and then I'm doing the circles, so the skin is gliding with my hands, not actually traveling over the surface of the skin or the clothing when I'm doing this. So it's kneading, fingertip kneading is the technique. How does that feel, Brandon?
Feels good.
Is it like pretty like tender or sore at all?
It's not too tender, no.
So spend longer here if the person's like really feeling it. You can use a broader surface. You can use the heel of your hand. You can apply some heat in this area for the person after you're done. Let them rest on their side with a heat pack right in there. And I'm going to attempt to give Brandon a little fascial stretch too. So try and leave your arm totally heavy, Brandon. And I'm just going to have his arm over his head. Just passively stretching the person. It's sometimes pretty relaxing. So I'm going to hold the arm and then just sink into the skin and gently press down towards his hips. And this is like a fascial stretch as well as potentially a muscular stretch depending on the person's range. Feels okay?
Mm-hmm.
So it could be a little bit burning, so just make sure that they're okay. You okay?
Yeah, I'm good.
So just doing cross hand spreading like that. Because we spend so long and so like large of portions every day with our hands, our arms down at our sides. So that fascia is sort of in like a contracted position, so it rarely gets to stretch open like that. So that feels really nice and is great for circulation.